Also in Jefferson City tonight, lawmakers believe nurses could fill the health care gap in the state, but face strong opposition from other health professionals. Our Missouri Capitol reporter Hannah Falcon spoke with healthcare professionals on both sides.
Missourians are in a healthcare crisis. A study from the Cicero Institute shows 111 of Missouri's 114 counties are in a healthcare professional shortage. Lawmakers think nurses could be the solution.
And they're just like 6 or 7 miles away from another city that has all kinds of clinics, but they can't get there.
As an advanced practice registered nurse in rural Missouri, Shayla Armbruster sees how difficult it is for her neighbors and patients to find health care. APRNs currently have to be in a collaborative agreement with a physician to treat patients and prescribe medications, limiting how much Armbruster can do for her community.
We've got to be able to get the people treated and get them healthy so they don't use the ER for a primary care.
A bipartisan bill being considered by a Missouri Senate committee right now would allow APRNs to operate independently after completing 2,000 hours in a collaborative agreement.
Really, this legislation is focused on the healthcare crisis in the state of Missouri, and we're going to try to resolve it by improving healthcare access.
It's about a scope issue. It's about giving quality care.
Dozens of physicians sat before lawmakers opposing the bill. Dr. Brian Biggers is concerned that allowing APRNs to practice independently without more training could put patients in jeopardy.
Things are routine until it's not, and so that's why you need oversight.
Every state bordering Missouri except Tennessee already allows APRNs to practice independently. If Missouri passes this law, it would be the 40th state to expand APRN's ability to practice. Reporting in Jefferson City, I'm Hannah Falcon.